terms of TV evolving as a precision tool for healthcare audiences, I think if we look over the past few years, there's been this incredible collision between premium supply and addressability. So on the supply side, you've got publishers that are leaning in with ad-tiered subscriptions, AVOD as we call it in the business. There's been more premium supply impressions on the biggest screen in your living room than ever before. When you pair that premium supply with addressability, at the trade desk we have an identity graph that allows us to resolve using UID to a phone number or an email address, and we can get very, very granular in the users, the HCPs, the DTC audiences that you want to reach across that biggest screen in your household. So when you combine that premium supply with the ability to know exactly who we're reaching, and we partner with a third-party RX data provider like Swoop, we're able to get really high fidelity audiences, understand who they are and where they're watching and reach them in that moment. And then the ability to measure those results as a result of business outcomes. So things like audience quality, script lift, et cetera.
And when you're talking about programmatic, why is it such a game changer for condition-specific targeting?
Yeah, programmatic is a game changer. I think it really allows us to be audience first in the way that we're executing. So we can start with patient populations, DTC or HCP, and reach them wherever they are across their omni-channel journey. So whether they're listening to a podcast, driving by a digital out-of-home sign, or again, just kicking back at the end of the day and catching up on movies or shows. So I think the ability to target, to optimize, and to measure in real time is all capabilities that are unique to CTV and really makes it an awesome choice going forward.
And so how do you see linear and CTV working together?
Yeah, that's a great question. I think more and more advertisers are thinking about CTV when they're deciding where to place their first dollar. So yeah, that comes back to being able to be audience first, that addressability factor. And then I think it's been bolstered by the fact that even content like live sports is starting to move to CTV and to these different CTV streaming publishers, which has kind of been one of the final last holdouts of linear television. No doubt linear TV is a great way to drive efficient, broad reach. I think when you couple that with the precision of CTV, the two are really able to work in concert to drive business results. I think the last piece that CTV offers is the ability to drive incrementality. So the ability to reach new audiences that maybe you're not reaching on linear channels. And we have tools that help us quantify that overlap between linear CTV campaigns, find pockets of new users, because we understand that our advertisers are seeing business outcomes related to driving new patient growth when they're reaching new consumers and patients that haven't yet seen their message.
And when it comes to targeting patients and healthcare audiences on TV, what's the biggest misconception out there?
Yeah, misconceptions. I think the first misconception is probably around scale. So when you're starting with an audience first approach, that oftentimes involves third-party RX audiences as opposed to sort of the linear demo-based play. We've seen no scale issues across these third-party audiences, and I think one of the beautiful things of working with a great partner like Swoop is they're able to upsize or downsize audience segments depending on the scale that advertisers need, while still maintaining a high level of audience fidelity. So when we're looking at metrics like audience quality, we're still seeing higher levels there, but still able to scale those audiences. I think in terms of a second misconception, advertisers oftentimes think there's this trade-off between premium supply and precision. And as we discussed before, there's more premium supply in the marketplace than there ever has before. I think a lot of consumers coming out of COVID got subscription fatigue. They got tired of paying for too many different services. And then publishers responded by adding ad-supported tiers, which has bolstered supply in the marketplace. So there's more premium supply than there ever has been before. And I think the ability to combine that with third-party data allows us to scale and allows us to be present again in the living room or on an iPad or phone that maybe you're holding a couple inches away from your face.
And looking down the road, how do you see technology further enhancing precision at scale?
Yeah, I think AI should allow us to move quicker and be more precise. That's the way we're thinking about it here at the Trade Desk. In terms of capabilities that will unlock, we've been focused on driving in-platform optimizations towards outcomes that our advertisers actually care about. So script lift, audience quality, getting lower cost per in-target reach. All of these things can be accomplished with this more near-term signal. So I think in traditional linear TV, you're waiting maybe 6 months to a full year for MMM results to come back. You're then iterating, and maybe those changes carry over to the next planning year. Being able to plan and optimize in platform in real time really allows advertisers to build their strategic advantage and iterate quickly so that they can drive business results.